In late 1901, Dr. Thomas Hayes agreed to build a hospital addition on the rear of his house at 113 South Spring Street in Bellefonte. The next year, Bellefonte Hospital opened its doors. A permanent location was needed, and in May 1903, the hospital relocated to the Willowbank building. The hospital remained there for 75 years.
Hardly a day goes by that I don't run into someone, whether it's at the grocery store or wherever I might be out and about, and people will stop me, and they'll want to tell me how important it is that Mounty Nittany Health is here in this community. It's really clear that when you live in a community, having access to strong local healthcare that means that you don't need to drive out of the community to get care, is really an important part of quality of life.
Continual growth led to milestones including the first surgery and the addition of an emergency room. In 1924, the name was changed to Centre County Hospital. In the 1930s, the hospital added its own ambulance, a 1938 Packard. The ER was a 9x12 room with an army cot, oxygen tanks, and instruments. The average patient census was 3 to 4 per day. The end of World War II was a period of tremendous expansion. Centre County Hospital increased the number of beds by 230%, but we still needed more space.
In the old hospital down in Bellefonte, we had a couple labor rooms. They had to be shared sometimes if you had more than 2 people in labor.
In 1966, Penn State donated 30 acres for a second medical center, which was dedicated in 1972 as a secondary location for Centre Community Hospital.
When I walked into the new hospital in '72, I was flabbergasted, really. It was like a beautiful place and lots of room, and the OB was much improved over what it was. We had more labor rooms to deliver on the same floor. We even got to the point where we could do cesarean sections in that area. We used to take them to the OR. So there were a lot of advantages to it, but it was mostly new and big.
In 1978, the Bellefonte Hospital location closed its doors.
I was born there. I saw it move from Bellefonte to State College. My family has used Mounty Nittany Health several times throughout the years, and it was fantastic, the level of service that was provided.
The 80s brought us closer to the medical center we know today, with new South and Health Service wings, as well as radiation therapy, neurophysiology, nuclear cardiology, and occupational therapy. By the 90s, the ED was state-of-the-art, providing care 24/7. The yearly census averaged 32,000 patients. Major additions included a new birthing center, new transitional care unit, lab expansion, and operating suite renovation.
It's remarkable to really think about how Mounty Nittany Health has grown with the community over the years. And that's allowed us to continually to bring new services, bring new providers, bring new facilities so that we have what's needed for the people that live here.
As we welcomed a new millennium, our healthcare system continued to change. In 2003, Centre Community Hospital's name was changed to Mounty Nittany Medical Center. In the years that followed came the East Wing, an expanded emergency department, a comprehensive cancer center, a cardiovascular pavilion, and a physician group with 220-plus providers with 19 primary and specialty care locations that serve more than 400,000 residents.
From the top to the bottom, you start with the executive director, and you have the doctors, you have the nurses, you have the people who bring their dinner, the people who clean the room, and are very protective of your privacy. Everybody has the right attitude. Everybody cares about you. Everybody wants nothing more than to get you healthy and keep you happy.
As you have seen, change is a part of our history. It has helped shape the unique character of Mounty Nittany Health, even as we have remained steadfast as an independent, community-governed healthcare system. As we move into the future with our team of 2,400 dedicated professionals, we will continue to celebrate the changes that are a hallmark of Mounty Nittany Health as we fulfill our mission of healthier people, stronger community.
The anticipation's building, the staff's excited, so we're ready for it to get here.
What I really liked about working here is it was a camaraderie with cooperation between me and nurses. You know, we were friends. I enjoyed it very much.
I enjoy working here. People were nice and get along good.